And it's working. Go ahead.
Okay, it's yet to come up on my screen now. Okay, that's fine. Hi. So my name is Anike, and I'm presenting a topic about mental health of farmers in rural Scotland. I'm a student of University of Aberdeen, Department of Public Health, and I have been on a 10 weeks internship session with the Rural Health Compass. So basically, mental health, I chose mental health of farmers because I have a background from farming, and I see it as a way to relate with farmers, considering this is a place where I have a background already. As a child growing up with parents who and grandparents who are both farmers, I understood the stress they went through one way or the other, even though it is in a different climate, but one way or the other, those stress are actually related. So getting down here in the UK, I tried to focus down on Huntley in Aberdeenshire, but because of the data gaps I had, I couldn't focus on that. I couldn't get much information from Huntley, and so it made me move to rural Scotland specifically. So my topic was supposed to be mental health of farmers in Huntley, Aberdeenshire, but it became mental health of farmers in rural Scotland. And from the definition of mental health, it's a part of our everyday health, just like our physical health fluctuates one way or the other, our mental health also fluctuates. And for farmers, these are people who are like the backbone of the economy, because most of the crops that they harvest and cultivate helps the economy one way or the other. And we also need to be very keen about their mental health, because what affects them one way or the other comes back to the society. And of course, a good mental well-being helps people to handle daily stressors and function effectively. It could be a one-on-one session, speaking on the phone to help them improve their mental health. It could be just going on an exercise that will make a person have a better mental health, a better day, and then it becomes a continuous thing, and it keeps improving, and it gets well for good. And I'll move over to the next slide now. On my executive summary, but when I did my research, I found out that farmers face a very higher stress, and it's also one of the highly stressed occupations in the UK, in the sense that they are among the top 10 occupational risks, which makes them prone to accidents and suicide. Accidents in the sense of working with machines like the tractors and losing concentration one way or the other, or falling asleep during the process, and they are prone to harms, accidents one way or the other. And so I found out also that one of the key stressors they had was isolation, because we all know it's very difficult to find a farm in the urban area. They are always in the rural area, and when you get there, they will have to go distance to get to groceries or basic needs they would have. You'd have to go distance to get to maybe town, except for some of the farms that are not deeply into the rural areas that are very close to town. They also have unpredictable weather conditions. For example, in Scotland, where you have weather conditions and that you wouldn't be able to cultivate all year round because of the winter period, the spring, and just a very little summer period for them, and all that. And of course, long hours working and financial instability. And about long hours working, this is something I found out in my research, that most of the people who have a farm to pass on to their children end up having kids who are not interested in the farm, first of all. So it makes them have to do all the job. They make little money from the farm, even though they cultivate a lot of products. The money goes into I would say the middleman bracket, that is from the farmer down to the middleman, and then it gets to the grocery stores. So the middleman probably adds up most of the prices, and then makes a chunk amount of money, while the farmer makes just a bare minimum. And from there, he has to pay taxes, pay water bills. Of course, in Scotland, you have to depend on the government for water. And when it has to do with soil agriculture, it's going to cost lots of water. It's going to take lots of water to get that done. And for the financial stability, it has to do with, unfortunately, because of the kind of research I was doing, I was not able to do primary survey. I was only going to rely on secondary data. And along the line, I spoke with, I met someone on LinkedIn who's also doing a related course in Napier University, and she was writing her dissertation, and she had a first-hand information with the farmers, and then I was able to interact with her and get some of the information that farmers shared with her, which includes fear of losing their farms because you'd have to get to pay a certain amount of money, and if you're not able to rent this farm within this period of time from the government, then you might lose your farm and then you're going to lose everything you're working for. This affects their financial instability. Sorry if I'm taking too much time. And they also have limited mental health access in the sense that most people try to bottle up. They want to talk to people because of one main factor, which is the people they are talking to, who could be the GPs, do not have do not understand how they feel as farmers. It would have been better if you had farmers speaking to farmers about their experience than just people who are in health professionals, but who are just health professionals who do not really belong to the farming field, who might not be able to relate. As a farmer, when you're talking about, oh, I will not be able to have 6 hours sleep because I have to wake up early and start to probably take my animals out into the field. And for someone who's a professional, he might not understand how he feels, but every single minute matters for a farmer. And also from my research, I found out about some promising initiatives like the Farm Strong, the National Rural Mental Health Forum, and all that. But some barriers remain, which are stigma and the service gaps, like distance to NHS. NHS is doing really great. I also did my research based on the data from the NHS Scotland, and I found out they have a goal set till 2027, which is which they are working highly to make sure they bridge the gap of mental health in rural areas. It wasn't specifically about farmers, but it was generally in Scotland, and farmers being part of the community. If this initiative comes in and plays and stands, then the farmers would benefit from it as well in the community. And then why this matters, like I said before, farmers are like the backbone of Scotland's food system because, of course, farmers in the rural area cultivate what is being uh, used, food that the people in the urban areas would have to rely on and all that. And of course, this is an interaction, which means the economy has to be affected one way or the other. So farmers needs to be given very needs to be prioritized and given attention in terms of their mental health. Poor mental health also has an impact on the families and the communities, exactly, because when you have, for example, uh, poor mental health in, let's say, a man who is a farmer and then his family has a poor mental health and it affects him one way or the other, he's going to go down into the family, have issues in the community. For example, when he ends up committing suicide, how is the family going to feel about missing him one way or the other? How is the other people around the community who are farmers going to feel about the kind of stress he has gone through to get to this point of his life where he decides to end it? And also, uh, when it comes to farm safety, like I talked about the high accident rates because they have access to, especially those who deal with mechanized farming, where they have to use heavy equipment in their farming process. They might sometimes not get enough rest. They might sometimes get into a mental breakdown, and then because they operate machines all the time, they might not concentrate and get to be affected one way or the other in the course of their duties. Yeah. So yeah, and then this is why this particular topic matters to me. So addressing it ensures resilient farming and rural well-being. So for those who are farmers and those in the rural areas will be able to have a better well-being and also trying to get away, the government can give them a a soft landing rather and have a better life, I would say. So in my research, I had 3 questions, which were what mental health concerns rural Scottish farmers face, and how well do the current policies and services meet this farming community's need, and also which parallel the community approaches shows promise in Aberdeenshire, and Scotland, rural Scotland specifically. So from my key statistics, I was able to find out that about over only 5% of farmers from the report in 2025 recorded a high well-being. That is, these were people who were able to open up. Most of the challenges people had from the reports I read also was that most of the farmers were not able to open up and engage themselves. So became so busy with their farming activities and then are not able to have a chance to get an interview one way or the other. I also listened to a podcast on BBC Radio and I listened and I heard about the same thing. It wasn't a show organized by the Highland Scotland, yeah, trying to help farmers to get yeah, but like a recreational lifestyle where they can just come out and meet each other and have a feel of the community. So, and also I found out that most of the farmers find it very difficult to step out, talk about their issues or leave their jobs as well. And from statistics, it says 1 in 3 farmers reports low well-being. It's about mental well-being. And 90% of the farmers under the age of 40 say poor mental health is the biggest hidden problem. And the references are attached to this slide. Sorry about that, not done. And lastly, farming. Oh, can you see my slide now? Farming, farming is one of UK's highest suicide rate occupation, like I mentioned before, which is among first 10 suicide occupations in the UK. Farming happens to be among them, even though it dropped from a certain number. I'm not very sure. I didn't include it in this report, but it still has a significant number there. And the major health concerns I found out in my research was depression and suicide, which was among the highest, of course, as farming being the highest rate of UK dangerous occupations. Depression and suicide happens to be one of the problems the farmers had to deal with. Anxiety and chronic stress due to workloads, weather, and market volatility. For example, like I said, they would have to think about lots. You have to pay out of your earnings. You'd have to pay taxes on water bills. You'd have to pay taxes on the farm rent, farmland. I didn't properly get it completely, but I find out that there's a certain amount of money they would have to pay for owning the farm and running the farm to the government. And if at any point they do not make a lot of profits and are not able to pay this money, one way or the other, the farm might be taken away from them, and it means losing what they've worked for. And sometimes these farmlands are something that's been passed on to them from generation, from their fathers or grandparents. So they'll be feeling so much anxiety when they're not able to get a good profit, not able to yield so much money from their productions, and this becomes a problem to them. One way or the other affects their mental health, and they might not really know about this, but it builds up and accumulates one way or the other and becomes a problem to them. Financial stress, of course, isolation, of course, because they live in remote areas and they have limited social interactions, and it makes them not to have people around them who they could speak to or decide to ease their stress off through conversations one way or another. And also financial stress, like I talked about before, they earn little even though they do much of the work, but the market people in the middle, like the middlemen of the markets, have to one way or the other earn more than even the farmers because they get this stock from the farmers and now sell to the big stores out there or export it on. So it means the farmers end up with less money than expected, and it piles up their financial stress, and sometimes it's difficult for them to get financial aid one way or the other, and this affects them mentally as well. And the stigma also, which has to do with people speaking about how they feel, and they just try to let you know, oh, you're a man, you have to just man up, you just have to be yourself, just try and stop thinking about it and all that. Instead of coming to them, speak to them, and find out how they feel truly and give a solution to them, they rather see it as a sign of weakness. Many men also do not want to talk about these challenges because farming also has a higher number of men in them than you'd have women. And it means many men would not want to talk about this challenge because of the stigma they'll feel and how people would refer to them after they've spoken about their challenges of mental health. Women and youth are also affected one way or the other. For example, in the case of youths, you have youths who are strong enough to take over the business from their parents, but because of how they're or because of the kind of anxiety or stress, financial stress on the parents, they do not want to give this business over to their children because they feel their children will run them down. Whereas the children are able to run the business and ready to run the farm. And this also becomes a stress to the children because they do not feel too good about themselves. It affects their mental health one way or the other. And also, there might be a kind of view attached to it when you have a woman running your farm, but it's not very strong in this axis. So you still have women running farms here, but just a very little number of them than you'd have the men. And some of the things I found that are already in place are the Farm Strong Scotland, which is a pair-led resilience. What they do here is you have people who are already in the farming system speak to each other about what they go through and try to tell their stories from when they went through this kind of situation, trying to encourage those who are able to speak to them. But then it's not just that, but it's not just enough to have someone come up and meet you and speak to you. It's going to be more beneficial if you can walk up to them, let them know about this initiative, because sometimes they might already be going through this stress and you do not know. But when you make them know about this initiative, they would want to choose to open up. We also have the RSABI, which has been very, very effective, and they have a helpline which you can always reach out to them. You call them on the phone. They are very practical and they give emotional support as well. We have Menshade, which is very, very active in the rural areas. Menshade is like a pubs where you can not like pubs, yeah. You could walk in and then it has to do with farmers who tell you just like about their experience and open up to you, and you can also open up to them. These are people in your communities which you know. They are also struggling, doing very great and trying to spread very well around the rural areas, making sure that they get to as much farmers as they can. And like I talked about previously, some of the gaps we had are stigma and low help seeking from people who do not want to seek help. There's long distances to get to the NHS hospital. The NHS is also doing very great and making sure, from the reports I got, they make sure they see their patients as fast as possible. I think in less than 48 hours, making the queue to be very, very reduced in those areas. The only problem the farmers have to go through now would be just to go travel a long distance to get to the NHS hospitals or NHS facilities, yeah. And funding uncertainty for grassroots is simply a situation where the farmers are unable to get fundings and unable to get subsidies. For example, when it comes to their water bills, of course, as a farm, you have to need lots of water because you have to seldom do irrigation is there so you can get your crops to do very well. And these bills will accumulate one way or the other. We know water bills in Scotland are it's pricey one way or the other. So it affects them. And if they could get a subsidy for that, it's going to help them very well. And then lack of tailored support for women, youths, and migrants who end up working in the farmland. I'm sorry if I'm taking too much of the time, Dr. Veronica. I'll just try to hasten up. So I just had my slides were going to be too long, but I had to break them down. I talked about the Farm Strong Scotland and how they share stories and podcasts, like and host peer workshops to help other people who are farmers. I talked about the men's shed also, which is like an informal or non-stigmatized male support group. These are approaches in the communities already that are helping and have been seen to be very effective. The National Rural Mental Health Forum, that's like a cross-sector advocacy and just the training, just to help them on how to detect when your mental health is going beyond how it should be and what you should do when you notice this kind of thing. Then the community-based support, which includes the phone helplines where you can always call them on the phone and they will speak to you. And they are also trying to launch a call set, more like just a call for 10 minutes. So when you speak to them, when you call them on the phone, they will have to be with you on the phone for 10 minutes at least to help you get over boredom and loneliness. And yes, the RSBI outreach, which intends to kind of mix of financial and legal support for the farmers. So most of them who are not very educated would not find it very difficult to go through some processes that has to do with maybe government policies and how it affects them. So they wouldn't be ignorance to them, or they would not just be novice in that situation. Yeah. And then the best approaches I found at the end were that this peer-led organizations were doing very great and were helping this situation previously than it used to be. And it's going very well. And then most of the farmers are getting informed because they come to meet them, maybe in the farmers market or in the pubs where they go to hang out most of the time, and they meet them there and let them know about this initiative, and it keeps growing from there, which is a very good one, because from here they are able to open up one way or the other. Since seeing that it's people of their of same community with them who are there, they are able to open up and get solutions and feel better from how they feel. And from my research also, I got to find out that one of the recommendations I have is that expanding the funds and the sustainability of the grassroots programs would be very important, because sometimes, for example, if they need to set up a mention in a certain community, you'd have to run it as a business, you would have to pay taxes. So if government can actually help them through grants one way or the other, extend funds onto them so that they can have this this business set up in order to help farmers in those rural areas, it would be a very good one. This would be just helping the grassroots programs to get better. And then developing policies for vulnerable groups, especially youth, women, and migrants. Why it affects migrants most is that most of the farms, because you have people who most of the farmers are not able to pay people according to the minimum wage and then hold them down in the farm. So the farmers end up doing this job by themselves. Most of the migrants are willing to get these jobs done with the minimum pay. And so they might be going through the stress of uh, are they going to be able to stay? Is this job going to be able to sponsor them one way or the other? So if there are policies that would be able to help them, these vulnerable groups, and keep them in the system, it's going to help the farmers to have a support and not have to rely on doing the job all by themselves. And for the youth also, it would be a way that since a person has been through, come from a family of farmers, and you don't have to necessarily hope and wait on to take up from your dad, your father. You could get if the government can bring a policy where you can actually get a certain portion allocated to you through grants, through the normal paperwork, and then you can deal in your own practice for a certain number of years before you probably receive the one that comes from your family. This will also give the youth a chance to express themselves and show what they can do by themselves instead of really hoping and waiting until they get an inherited portion from their family. And create an integrated pathway that links the NHS and charities and communities. This simply would mean when you have the men's shade or you have the Farm Strong Scotland communities, you'd have a GP, psychologist, a psychiatric in their midst that teams up with them and work with them. So when they go to meet these farmers or when they are in the pubs together, they talk to them and then they pick out one of the issues they might be having and do a follow-up from there. This way, you'd be able to help them reduce the mental health stress and promote stigma-free conversations through national campaigns. Of course, let people understand that speaking up is not a crime, and then speaking up doesn't make you less of a human, and making them see that indeed when you speak up, you get a solution. The earlier you speak up, the better you get a solution. And also to invest in digital and remote mental health tools for for rural reach. And this is like developing an app where you'd be able to enter your your mood. I don't know how it's going to be done, but how you feel for the day. And so this app will be able to track you and see if you're getting beyond the threshold of your mental state. And then are you going into being slightly depressed, or are you having anxiety? This is what the government would NHS would probably have to look into one way or the other, because it would be very expensive for an individual to fund this project. But this is part of my recommendations. And then in conclusion, progress made with awareness, pay initials, and prayer forums, which are very effective so far and needs to be done more. And challenge persists like stigma, accessibility funding, and coordination gaps, yes, but they can be better And because when we look at the results that has been created so far, then it simply makes the charity organizations to do more and not relent. And if we get a little more support from the government, then this would be almost scattered all over the rural areas of Scotland, and it would be targeted at farmers, and we will assess them through the farmers market, through the pubs where they meet, and through organizing farmers organizational events, and where you can meet them, interact with farmers, speak so they can one way or the other be comfortable with you to speak about how they feel. And the way forward would be a stronger collaboration with the government, NHS, charities, and farmers. Yeah, and with a comprehensive strategy, Scotland can build a resilient and thriving rural community. Thank you very much.
Thank you, Williams.